All right, we are in the middle of Medicare open enrollment, and the choices can make your head spin right off.
Yes, joining us now to talk about what you need to know is Mary Snyder. She's the CEO of UnitedHealthcare Medicare and Retirement New England. Thank you for being with us.
Yeah, thank you for having me.
All right, Mary, tell us about the pepper and the pumpkin pie real quick.
Yeah.
Okay, this is legit. I actually have a pumpkin pie recipe where pepper is the secret ingredient.
We love you. Thank you so much. You've made our day.
Ours is going to come out then. See, this is why you got to go to an expert, and you have a lot of answers, especially for seniors and other people who are enrolled in Medicare. You can teach them how to make a pie, but just remind everyone why this annual enrollment is so important right now.
Yeah, I mean, choosing a Medicare plan, it's really one of the most important decisions that a person can make for their health, their well-being, but for their wallet too. And people's needs, as we know, they change over time. So the annual enrollment period is that time to see if your current coverage still meets your needs and if there are any new benefits or even cost savings opportunities to take advantage of.
Medicare, it can be overwhelming. So can you offer any advice to help make the process of choosing a plan a little bit easier, Mary?
Sure. Choosing a Medicare plan can feel complicated, but it doesn't have to be. There are safe and effective ways to get help. If you want to talk to someone live from the comfort of home, UnitedHealthcare has simple, no-contact enrollment options through our website or toll-free number. And I love to tell people there are licensed agents right in your own communities that can be a great local resource for personal one-on-one help.
Yeah, which is really important, right in the local community, which is great.
Right, and we were showing that not, one size doesn't fit all. So what you pick can really have an impact on not only your well-being, but your budget.
Right, exactly.
All right, so we are talking about the Medicare plan you select can significantly impact your health and well-being. What are some of the most important things to consider when enrolling in the Medicare plan? I know my mother's going through this right now.
Yep, so many things to consider. And it's also important to know plans can change a lot every year. At UnitedHealthcare, we know, especially among our older adults and people with disabilities, stability matters. And our 25 years experience in Connecticut has taught us the importance of having predictable and affordable benefits year after year. And it's really a big reason why today, nearly half of all of the Medicare Advantage members in Connecticut choose UnitedHealthcare. Our plans are designed to meet the growing and varied needs of consumers, like plans for people who are eligible for both Medicare and Medicaid, plans with no monthly premium, $0 copays for primary care visits, $0 virtual visits, and I love this, free fitness memberships, dental and vision care, and just so much more. So important to consider, that affordability, but also knowing that your benefits are reliable and that we bring things original Medicare doesn't. But I do tell people one of the most important things is none of that matters if you can't actually see the doctors and hospitals you need. Exactly. UnitedHealthcare's got one of the largest networks across Connecticut, including all hospitals in the state. And we have the largest national network that members can access without referrals. So wherever you are, members pay network costs when seeing any one of our more than 1 million care providers, which really reduces worries when traveling or for those great snowbirds who love spending their winters in warmer places.
Yeah, which is, you want to have coverage wherever you are. You also want to consider whether or not you need the dental, the vision, the other outside of your outside of the medical.
Right.
Yeah. And you need to help us with that. And also the cost of your medications as well. That's something that we really need to focus on. Are your prescription plans going to be covered?
That's right. So access to affordable prescription drugs continues to be among the highest ranking priorities among our members. So when you're looking at your plans, you want to make sure that your medications are covered and that your pharmacy is in the plan's network too. And then keep total costs in mind. And that includes things like deductibles and drug copays. UnitedHealthcare has plan options with no Part D deductibles and $0 copays on generic drugs. And we also have a great benefit for members with diabetes that we introduced last year. It limits the monthly out-of-pocket costs for all covered insulins to $35 or less per month. And that program saved eligible members an average of $450 this year. Another great thing to consider is mail order. Mail order, many plans will offer a 3-month supply of medications delivered straight to your home for less than you'd pay at a retail pharmacy. So it really does help to look into all of these different, areas and options and make sure that you've got the right plan for you.
Well, Mary, I don't know what looks better, your hair or your backdrop, but you did an amazing job today. So thank you so much.
Thanks.
And we want to let people know where they can go to more information, that you should visit uhcmedicarehealthplans.com, or you have a phone number you can call 855-515-3774. All of that is right on the screen right there. Thank you so much. I hope people
Thank you, Mary.